Ladies and gentlemen, I'm Dr. Larry Burchett, and I'm joined by one of my favorite people in the world that I went to medical school with, Dr. Jenab, MD. Dr. Jenab is an actively practicing ER doctor where are you practicing in Colorado?
In Craig, Colorado, and then also in North Dakota, and soon to be in Albuquerque as well.
Jane and I practiced together in Mendocino for years. Those were good times for me.
Those were the days.
And we became very good friends. And Jane reached out to me today, Dr. Jenab, and said, hey, I think things are worse than what I was saying in my posts and writing and talking about. And so I wanted to have a conversation and just be transparent with people about what's going on, and we may have different perspectives. I think we're on the same page with a lot of things. I just wanted to have a conversation about that. So, Dr. Jenab, thank you for being willing to challenge me and have a conversation. So I'm going to turn it over to you. Tell me what you think, and kind of you were looking at some of the stuff and you're like, this just doesn't feel right. Tell me your thoughts about this whole coronavirus thing and where we're at, and most importantly, what's coming.
I think that I have been monitoring this from close to the beginning. I have been probably on a daily basis spending an hour or two every day looking at the numbers, reading the research, reading the information that we're getting from places like China and Italy and Iran and Spain. And pretty early on, I had the feeling that this was going to be more serious than people were making it out to be. I have watched the numbers grow. I've been keeping track of the case fatality rates, the percentages. And while I do really believe that the majority of people are going to be just fine, the numbers are not really in our favor when it comes to the actual percentage of people who are going to be ill enough that they're going to require hospitalization, usually for at least supplemental oxygen, but potentially more aggressive interventions. That's looking to be about 15% of the population if we look at the numbers from the other countries that are kind of on the front wave of what's coming to us. And then looking at the ones who are critically ill, we're looking at about 5% of the cases. And those numbers are far beyond what we have the ability to care for in our hospitals right now, just from an ICU bed standpoint, from a physician and nurse standpoint, from the standpoint of how many respirators we have in this country. And I'm involved in several groups that are actively tracking this, both emergency physicians, critical care physicians, and just concerned people in healthcare trying to share ideas, trying to share thoughts on how we're going to manage the volumes that potentially are going to overwhelm our system. And, I've been doing my best to try to share that information with people on my page. And this is the first time in my life that I felt the need to kind of take a public stand and to try to warn people that we're in for a really rough ride. And I think that you and I, we have the same education for the most part. We went to the same medical school. We practiced in the same hospitals. We've known each other for a very long time. Yep. And I was reading your posts, and the feeling that I had was that you are trying to allay people's fears. And I think that is a good thing to do. I think that panicking is not the answer. I do think that we need to let people know that we are going to get through this and that we're going to come out the other side. But in the interim, life is going to change pretty dramatically for a lot of us. And we as a nation need to pull together, and we need to do the things that we can do to keep the most at-risk populations as safe as possible. And that means social distancing. That means not going into work. That means having your kids at home with you for a while, because that is how we can slow the spread of this and give the healthcare system a better chance of being able to deal with the surge volumes that we're going to be seeing within the next few weeks to months.
So let me kind of repeat and restate some of the things that the concern is that you're bringing, where this message may not have clearly come across with mine, but the worry is that when coronavirus comes through the United States and a lot of people get infected with it, a large percentage of the population, depending on how many people get infected and how many get infected at once, like everybody getting sick at once. So many people may get critically ill, needing not just oxygen in a regular hospital bed, but their lungs may fail to the extent where they need a tube and they need life support in order to continue breathing and surviving, and that there's a risk right now that we may run out of ventilators and ICU beds and not even have beds for these people, because this virus is so contagious. And for some people, especially those with risk factors for lung disease, elderly folks, 70, 80, etc., are at higher risk for having these problems. And so I think one of the fears that the Tim Ferriss doctor and then you're talking about is, God, if we get so many people that need ventilators, what are we going to do if we don't have the ventilators? If we don't have the ICU beds, what are we going to do? Is that right? Is that the concern? Did I say that correctly?
That is absolutely correct. What we're seeing in places like Italy and Spain is that they have run out of ICU beds, they have run out of ventilators, and they're having to make very difficult decisions, which is something, as a physician, I don't want to have to do. But there are cases where it's not, well, the individuals who are at higher risk are those who are elderly and those whose immune systems are not working as well as perhaps a younger, healthier person's would. We are also seeing some younger people who are critically ill, and they're having to make difficult decisions and say, listen, over a certain age, we are potentially not going to be able to treat you. We're not going to be able to do these life-saving interventions because we simply don't have the supplies and the capacity and the staff. And I think
triage, like mass casualty triage, really.
Exactly. And again, I don't think that the majority of the population is going to become ill like this. What we're seeing is that they're not. Children
most
in particular
people are
seem
going to
to
be
do
fine.
very well.
Children are going to be fine.
Exactly. For the most part, kids are either almost asymptomatic or they just have, what seems to be cold-like symptoms. And that's, for people who are maybe in their 20s, 30s, 40s and are not particularly ill to begin with, they have more of a flu-like illness. It's really the older populations in general that are potentially going to get very sick. So I think what our conversation was earlier and why we decided to speak today is that I think that there's a balance to be struck between being honest with people and being upfront with what we're really dealing with on the front lines. And you and I, as emergency physicians, are on the front lines. And also, trying to allay people's fears and not encourage any type of a panic, because I don't think that in any way is going to help anybody. But I do think, we're both trying to find ways to share with our family and our friends and our colleagues the information that we do have, because information is powerful. It allows us to prepare. It allows us to not be surprised, as a lot of people were this past week, when abruptly there was a state of emergency declared. And most people, there were a lot of people out there who were thinking this really isn't a big deal. And what I feel a responsibility to do as a physician is say, yes, this is a big deal. But there are incredibly talented, incredibly hardworking, incredibly self-sacrificing people on the front lines that are going to be there for you. But also we need to be realistic about what we're going to be dealing with.
I don't think I disagree with anything you said. I want to explain a little bit, because I've talked about this in the media, not just my my webpage the first time that I went on KTVU at San Francisco Fox. When this thing first broke and it was a coronavirus, people were like, "Oh my God, is this MERS with a 30% death rate, and is it SARS that's a 10% death rate?" And in the beginning, we didn't know. Numbers started to come out: 2%, 3%, 5%, less than 1%. And this panic began. Like, this is the viral apocalypse. When I looked at the initial literature, especially that New England Journal article that said, well, it doesn't look as bad as we first thought, and it's certainly not as deadly as MERS and SARS, the core message that I wanted to communicate to people was, this is not the end of the world viral apocalypse where everybody is going to die. And that is still the case, because kids are going to be okay and most adults are going to be okay. Okay, period. That's message number one. This is not, so that's what I meant by comparing it to influenza, and it's not that. Now, things have evolved, and what we know now, to echo what you're saying, is that, look, kids, most adults are going to be okay, but this thing is very contagious. It is going to continue to move through the United States. And there are scenarios where if a lot of people get sick all at once, we're going to be in big trouble running out of ventilators. We're going to run out of things that could otherwise save people's lives. Some of the numbers I've quoted, and give me your opinion on this, these Iran, Italy, places like that, mortality can get up to 5%. If you, on the other hand, if you have the resources, it can be down to under 1% if you have the vents and the appropriate care and everything. I think I said that earlier today and yesterday. And that's why we're mobilizing, and everybody's encouraged to do their part with this social distancing, washing your hands, and avoiding all the inessential stuff where we know this thing is, and avoiding all that stuff is to do your part to save lives like that. I totally agree with all of that. Whatever the experts are recommending now, that should be done in order to save them.
Yeah. I think it's important for people to know that they have the power to save lives. They have the ability to slow this spread and to give us the chance to be able to care for everyone who comes in. And it really is, we really are relying on the community, we're relying on the nation to pull together at this time to give us a chance. We're not going anywhere. You and I are going to be there come hell or high water. And, we're risking our lives, quite honestly. Some of us have underlying health issues that put us at a higher risk. We already have multiple ER physicians that we know of who are intubated and in the ICU because they were the people who took care of the COVID-positive patients initially. So, but that's not going to change. We as physicians will be there for you. We as physicians are going to work our fingers to the bone to save every life possible and to care for everyone who comes in for other issues. I mean, this doesn't, one of my concerns is that we know as ER physicians and ICU physicians that we already are close to capacity on a normal day during flu season.
It's not like all these ICU beds are empty waiting for corona, because that's not true at all.
The ICU beds are full with people who are critically ill from other reasons completely unrelated to the coronavirus. So, we still have to be there for the strokes and for the heart attacks and for the stabbings and for the shootings and for, the
and for the people sick with the flu.
Exactly. So, whatever people can do to help us decrease the volume of non-emergent visits to the emergency department. If you stub your toe or if you have a cold but you don't have high fevers and you're not having difficulty breathing and things like that, those are the cases that we are hoping will choose to not come in at this time, quite honestly, because we are going to be overwhelmed with people who are critically ill or dying that we're going to need to care for. It is hard for us because we want to care for everybody, but we have to be realistic about what we're going to be seeing in the coming weeks and months.
Winter is coming, to borrow that from Game of Thrones. It's not the case that, oh, okay, we've done a week of social distancing and staying home, and this thing will be gone in a week. This is going to be weeks to months. It's going to get worse. Like I've been saying, now that there's more testing, people are going to see. They're going to report. The CDC yesterday said there's been 1,200 positive confirmed cases of corona. As we test more, that's going to go boo. Both spread.
The numbers are probably 10 to 20 times higher than that of people who have the infection but simply have not been tested. So
way higher than that.
The truth of the matter is that there are many more cases out there. We just, here's one of the biggest struggles that we've had from the outset is that we don't have the ability to test. We were just told here in Colorado that unless we are admitting a patient to the hospital, that we are not allowed to do a test. Where I work in other states, we still have to go through the health department in order to run a test on someone.
So
that does not mean that the individual who's sitting in front of us doesn't have it. It means that they don't meet criteria, very strict criteria, to be tested. So we have probably already seen, I've probably already seen, 50 to 100 people who had it that I could not test.
You think you've seen that many? I think I've seen some, but I don't know if I would say that many.
The problem is the symptoms are very similar to the flu.
How can you tell the difference? Without that test, you're flying blind.
Quite honestly, we can't. The things that seem to stand out with this illness is that you have fever and a dry cough, and then progressive difficulty breathing. That's for the more ill patients. But the ones who have a milder version of it, they might just have some body aches and a low-grade temp and a cough. And that's the same thing that you tend to see with the flu.
So what you would say to somebody if they happen to get sick and they're worried they have corona, if it's just a fever and a cough and they otherwise feel okay, probably best to stay home, not even come out. If you develop shortness of breath, you feel really sick, you feel worse, altered mental status, this kind of stuff.
Absolutely come in and see us.
That's when you need to come in.
Absolutely come in and see us in most cases.
Yeah.
But honestly, there's really no treatment at this time. Most people are going to get it, and they're going to get better in a few days. If you are having those symptoms, honestly, whether they are the flu or they are coronavirus, the smart thing to do is to stay home and to stay away from anybody who might be in those higher risk categories. Again, older people, 65 and older, particularly 80 and older. Anybody who's got difficulty with their immune system, or anybody who has a lot of other chronic medical issues, including things like COPD, heart failure, diabetes. All of those things play a part in whether or not your immune system works, or your lungs are going to be able, or your heart is going to be able to handle this illness.
I want to get back to what we were saying a second ago, because I want to make sure that people are hearing this, which is why we're having this conversation. Things are going to get worse, a lot worse, before they get better. I said that both times on these Facebook, social, whatever, live things. You're going to see a lot more cases. You're going to see a lot of deaths. I know people are freaked out right now. They're going to get even more freaked out in the next couple weeks, month, because there's going to be more reporting of all of this stuff. We may get into these problems that you're worried about. Very, very right to be worried about those things, Dr. Jenab. Running out of ICU beds, running out of ventilators. We may get to that point. What do we do then? What is the message then? And the message and you can plug your thing in there too. The message is, a lot of it is the same message. Do what you can. Wash your hands, stay at home, etc. We're going to be here. You and I were talking about this, Jane, and I feel this preparation adrenaline of going, look, I wish the system was better. We had more capacity. I wish that we would have started testing 2 months ago. I wish that we had a more proactive president who would have done the right thing when people, all of these things that are really outside of not only doctors' control on the front line, but the public as well. All those public health measures, it's a conversation itself. But what I want people to know is that, doctors, nurses, techs, paramedics, EMTs, respiratory therapists, all of us, we know we're preparing for a war and for battle. And we're heading into a thing where it's risky to us. I mean, I put this in that post. I was like, this is September 11th, baby. The Twin Towers are on fire, and there's firemen that are running to that thing, and there's people that are running away. And I want the public and people to know that there's a whole lot of us that are digging in, that are going to work, that know that the next 6 weeks, couple months are going to be rough. They're going to be stressful. They're going to be long, horrible hours. They're going to be not ideal medical conditions. It is not going to be good, and it's going to be even worse in the media. The panic is bad now. It's going to get even worse. And we're going to get through it. Somehow it's going to be okay. We're going to lose some people. People are absolutely going to die. And I pray it is nobody close to you, And I think about so many people in this, from colleagues that I work side by side with, to my grandma, to I think about everybody too.
Yeah.
I'm worried about that stuff too. And this viral season will come to an end. There will be an end to it. It's not going to go on forever. It isn't going to wipe out the entire United States of America.
No.
That kind of level thing isn't going to be there. Those of us that are in this thing, we're heading into battle and we're going to do our best. It's going to be rough. We're going to be there and we're going to get through it.
We are, and we're going to take some casualties within the healthcare system. So I would ask people to be kind. We're going to be working hours that we've never seen before. We're going to be exposing ourselves to this time and time again. We have a lot of older colleagues and a lot of people that we work with who are going to get ill and potentially succumb to this. So, be kind to the first responders, be kind to the healthcare workers, maybe send the ER some pizza. I've been urging folks that, folks are feeling helpless and like they want to help. Sometimes we're working 12, 15, 18 hours straight. We don't have time to eat. We don't have time to use the bathroom. We don't have time to sit. And, little things like that can go a long way. But more than anything, just know that we as a nation are going to be okay in the end, but we have a rough ride ahead of us. And whatever we can do as individuals, take the responsibility and take the power into your own hands to help your fellow Americans and the healthcare system to minimize the damage from this is something that I think we should all strive to do.
Let's go do it. Let's go do it, Jenab.
Let's go, Lorenz.
Do you have any? Did we cover it?
I think so. I think,
Do you feel good about that?
Yeah, I think that, I'm glad I spoke with you because I do understand, though, that we are on the same page. Maybe we're on either side of it just by a tiny bit, and somewhere in the middle, I think, is where the truth lies as to the best way to get the message out to people. But I'm so grateful to have you in my corner and to know that you and all of our colleagues are going to bring our intelligence and our compassion and our sense of duty and our selflessness to care for the people of this country. So that makes me feel good.
I'm going to be thinking about you, Dr. Jenab, take care of yourself. Don't
Thank you.
work too much. Get plenty of sleep. Love your animals for me. We're going to get through this. And like you're saying, this is a piece of history. And we're going to war. I'm honored to go to battle with you. I truly am.
I feel the same way. Love you, Lorraine.
Love you too. Thank you for talking.
Anytime.
All right.
Bye.